it's Dr. Aimee, and today I want to talk about something that I consider one of my biggest challenges as a veterinarian. And I know, imagine that, right? We have challenges in our lives. But I think one of my biggest challenges, one of the things that distresses me the most, worries me the most, is the idea that many times my clients, owners, you as a pet owner, put on what I would call virtual blinders. And I do not believe in any way that this is intentional. I don't think people intentionally ignore an animal's needs or an animal's illness or an animal's pain. But it is really, really a common problem. And we, as human beings, we don't ever want to think that our pets are hurting. And so what we will do is we'll honestly not even see what's very obvious to someone else or to even myself who has a trained eye to look for certain things. And it's my job, in my mind, as an advocate for you, as an advocate for the pets, to actually point these things out and to help educate you so that you are no longer walking around with those blinders on and seeing through what I would call tunnel vision. Okay? The thing that comes to mind and that I think about and I mention to people all the time is the difference between a medical doctor and a veterinarian is much more dynamic or greater than just the fact that we're dealing with humans versus animals. When it's a human, the human is the one feeling the illness or feeling the pain, and we want it to stop. And so we're going to take action steps, and we're going to go to the doctor or we're going to talk to somebody, and we're going to make a conscious effort to fix the problem. Well, the difference with these beautiful, beautiful animals is that they depend on us to speak for them. They depend on us to see that they are in pain, or that they are not eating, or that they are losing weight, that they have been vomiting for 5 days. They've been hiding under the bed if they're the kitty. And they're depending on us to notice this, and they're depending on us to recognize it's a problem, and then they're depending on us to take the action steps to help them. And that is what I see often, many, many, many times, not happening. So it's that second level, right? When you feel the pain, you feel it and you want it to stop. When they feel the pain, you often convince yourself that they're not really feeling pain because it's not you feeling it. And then we convince ourselves that everything's okay and, oh, we can wait a little while. And guys, the problem with that is if you wait, you could wait too long. And then I'm having that conversation with you about there may be nothing I can do, or if there is something I can do, it could be quite extensive. And in the meantime, we have to think about what they have gone through and what they have very silently suffered with. Okay? So one of the biggest things is often and early. So the more frequently we see the animals and we are able to have a discussion with you and we have a relationship with you and the pet, and we can put our hands on them and we can touch them and we can feel them and we can ask you the right questions, we can better educate you and we can better detect the problem. I remember a time when I had a client come in and we were just there, she was just there for a wellness visit, and I was watching her dog and I was watching the dog go to sit down and then go to lay down, and you know, you could just see the dog kind of shimmying and just reluctantly laying down, and I asked the question, have you noticed any signs of pain or discomfort? And she's like, oh no, not at all. So then I evaluated the dog and I showed her what I was seeing. And then we went on to schedule an appointment to take some x-rays, and this pup had severe, severe hip dysplasia. And she was in tears. She was mortified. She was horrified because she really just didn't know. And so we were able to address the problem. We were able to relieve this pet's pain, and she was just so incredibly grateful. And the animal was incredibly grateful. So that's, to me, that is probably one of my number one challenges as a vet, is making certain that my clients are not going along wearing these invisible blinders, and that knowing that we are here to help. My job is to help you. I'm not here to judge you. I am not here to slap your hands. I am here to help you see what you maybe don't see. And from there, we can take the steps to help your best friend, your buddy, okay? So I know this was really beneficial to you. I know that maybe my saying these words, you'll look at things a little bit differently. I look forward to seeing you more frequently, and I look forward to talking to you further about anything and all things regarding pets. Again, thank you. This is Dr. Aimee.